Okay guys, let's talk about adrenergic antagonists, which are also called sympatholytics. So let's start with the location of their receptors. So we have the beta receptors and the alpha receptors. So for the beta receptors, their location, we have the B1, the B2, and the B3. The B1 are located at the heart and JG cells, while for the B2, they are located at the bronchus, GIT, bladder, uterus, liver, blood vessels, skeletal muscle spindle. For the B3, they are mostly located at the adipose tissue, but you can find them at the coronary vessels of the heart and the urinary bladder. Guys, let's talk about the alpha receptors. So the alpha receptors, we have the alpha 1 and alpha 2. For the alpha 1, we have the alpha 1A and we have the alpha 1B or alpha 1D. So the alpha 1A is located at the prostate, at the eye, and the urethra, while for the alpha 1B and alpha 1D, you find them at the blood vessels. Don't forget, the alpha 2 are located at the blood vessels and brain. Guys, let's talk about the real business here, the alpha blockers. So, the alpha blockers are divided into 4 subclasses. We have the non-selective alpha blockers, we have the alpha 1 blockers, we have the alpha 1A blockers, and we have the alpha 2 blockers. So, for the non-selective alpha blockers, which are the phenoxybenzamine, phentolamine, and tolazosin, let's talk about them. So, phenoxybenzamine is used to treat pheochromocytoma for a long term because it lasts for 24 hours. The side effects of the phenoxybenzamine here are the postural hypotension and the reflex tachycardia. While for the phentolamines, it is used for short-term management of pheochromocytoma, and the side effect of it is that it produces this postural hypotension and induced reflex cardiac stimulation and tachycardia. It lasts for only 4 hours. Tolazoline is used to treat pulmonary hypertension in newborns. So it is for those guys in pediatrics. Yeah. And don't forget, it is also used for hypertensive crisis associated with clonidine withdrawal. Guys, let's move on and talk about the alpha 1 blockers, which are the parazosin, tolazosin, and doxasin. They are used to treat hypertension and congestive cardiac failure. They are used to lower the arterial blood pressure and lower the peripheral vascular resistance. The side effects of these drugs are dizziness, lack of energy, nasal congestion, headache, drowsiness, orthostatic hypotension. So, let's talk about the third class, which are the alpha A1 blockers. We have the tamsulosin and silodosin. Tamsulosin and silodosin. So they are used to treat the benign prostatic hyperplasia, and they have this minimal orthostatic hypotension. They produce this smooth muscle relaxation of the prostate gland and the bladder neck. The last group of the alpha blockers, which are the alpha 2 blockers, an example here are the yohimbines. They act as sexual stimulants and they block the A2 receptors, thereby increasing sympathetic flow and blood pressure. Let's talk about the beta blockers. So, the beta blockers are also classified into 4 classes. We have the non-selective beta blockers, we have the beta 1 cardioselective blockers, and we have those class that combines the beta 1 blockers with partial beta 2 agonist activity. And the last of the class here is the lipid insoluble beta blockers. So for the non-selective beta blockers, we have propranolol, timolol, nadolol. While for the cardioselectives, we have atenolol, esmolol, bisoprolol, metoprolol, nebivolol. And the benefit of these cardioselective beta blockers is that they are safe to use on asthmatic patients, safe to use on diabetic patients, and they have this less risk of developing dyslipidemia in patients, and also the less risk of hyperglycemia with patients. Okay guys, let's talk about the beta 1 blockers plus the partial beta 2 agonist activity. The drugs here are the acebutolol and pindolol. Finally, for the lipid insoluble beta blockers, they are mainly excreted by the kidneys, so they are contraindicated in renal failure patients. Example of drugs here are the cereprolol, satolol, nadolol, bisoprolol, acebutolol, and atenolol. Okay, let's talk about the alpha and beta blockers. They have these two actions of blocking the alpha and beta receptors. Drugs in this class are labetalol and carvedilol. So let's talk about orthostatic hypotension. It is seen with vasodilators. Vasodilators like organic nitrate, hydralazine, minizodil, and also with clonidine. Don't forget about that. Bye for now.